Warm greetings to everyone. Welcome to today's Physio TV session. I am Dr. Sheetal Agrawal from Sancheti Institute of Orthopedic Rehabilitation, College of Physiotherapy. I am the moderator for today's session. It gives me an immense pleasure to welcome our speaker for today's talk, Dr. Madhumati Mukherjee ma'am. Ma'am is currently working in UK for NHS as a senior physiotherapist in trauma and orthopedic department. She has been a clinical team lead for private hospital in UK before the current job. Her last job in India was as an assistant professor in musculoskeletal department at Modern College of Physiotherapy, Pune. Ma'am has done her master's from Sancheti Institute College of Physiotherapy and bachelor's degree from DES Brijlal Jinda College of Physiotherapy, Pune. Uh, she has been living in UK since 2 years. We welcome you, ma'am, for today's talk, and now I will hand over the session to you.
So thank you so much for your warm introduction for me. And first of all, I would like to thank Physio TV and Sancheti Institute College of Physiotherapy for inviting me. And I have been wanting to contribute to this excellent initiative by the college and the institute in general for a long time. And here we are today. And last but not the least, I would like to thank Sona ma'am for being so patient with me and for working out the whole timings and all the procedure and how to go about how to go with it and all those things. So yeah, today I'm here to talk about a little bit of my experience in working in UK. And I thought it would be a great platform to kind of let everyone know of what I have been through, how I have been managing here, which is quite a recent experience of mine. And I have been getting a lot of requests from our few seniors, few of our juniors saying that how did you progress through in UK and what did you do and how did you go about. So I thought this would be the best thing to kind of share a little bit of my experience of how I have been managing here, how or what all things I did, what all things were needed when I came in here, and how I managed to get a job here and all those things. So I thought it would be a little bit of a guidance, if I may say so, to for all the juniors who are looking, or even people who are looking to kind of come here and start working. And while I go through my talk, you will understand how I went about with everything. And yeah, I would say let's start. And let me share my screen so that everyone can see it. Just give me a second. All right. So yeah, the main thing here which I would be talking about would be my experience of working in UK. It is not a cut through guide. It is not like the ultimate Bible here, but it's just my own experience of how I went through, and I think it would be helpful for someone who's looking to kind of go about it, like how to go, what to do. So the many a times people have this question that what's the first step, where do we start, what do we look at. So I think this may give a little bit of a reassurance as well to anyone who's looking to work here. So let's get started. In brief, a little bit of my I have it's already I have been introduced well, I would say. But just a quick introduction regarding me so that people know from where I started and what was the baseline. So I have done my bachelor's from DE Society's Brijlal Jindal College of Physiotherapy in Pune, and I'm an alumni of Sancheti Institute College of Physiotherapy. I've done my master's in MSK, musculoskeletal physiotherapy. So after this, basically, I was working in a college in Model College of Physiotherapy as an assistant professor in musculoskeletal physiotherapy. So I worked there for approx an year or so, and after that, that was COVID times. I got married, and after marriage, my husband was posted here in UK. So I came here on a dependent visa. So that was my first step. When I was coming here, I had absolutely no idea how I would go along and what I would be doing here. But there was just one thing, that I wanted to work as a physiotherapist here. So I had some guidance from, some colleagues and a few people who could, guide me through, or at least told me what to look for and where to look for. So that was a big help. I searched a lot about other things as well, like what the prerequisites would be. So I had requested for some transcripts for both from my from the so basically, when I was requesting for those transcripts, it was told to me there was some new rule which was there, or rather a change in rule at that time, which was basically, if you want after your graduation or your graduation transcripts, you don't have to go to your graduation college. You can directly request for it from your university, which is MUHS. But for masters, it has to go through via your master's college. So I went to Sancheti, and I should genuinely say that they helped me a lot in a very short time, I must say. Uh, um, we requested for transcripts. It was all made very easy for me. And the transcripts came through to my home. And yeah, so this is something which was not requested by HCPC. I'll come in a minute about what HCPC is, all that. But it was not requested per se in the HCPC, but I had been suggested by my colleagues who were guiding me that it would be helpful if you kind of add those transcripts in the file which I was going to send, the whole folder rather, which I was going to send. So that is one thing which I had made a preparation for, like a pre-preparation before I traveled to UK. And the other big preparation, I would say, or the main thing, was appearing for IELTS exam. So you can go through the site. It is quite good. They have mentioned everything you need. And I personally did not join any classes, but there are many classes available, is what I know, in Pune. So if anyone wants to join those classes, it would be a good platform to learn and score good marks, because there's a certain criteria which you need to fulfill. There's a baseline which you need to score to kind of work here, or maybe rather get registered in HCPC. So that was these two things were like a prerequisite before I traveled here. So yeah, it's now been 2 years for me in the UK. And as I was mentioning about HCPC, when I was coming here, I knew the utmost important thing to work in UK would be HCPC registration. Um, just to clarify, health HCPC is basically what I would call an equivalent to, say, OTPT Council of ours. So you need to be registered, you need to be authentic enough to work here, or in Maharashtra, if you have got that OTPT Council register or HCPC for here, you can actually work. If not, you are not authenticated enough to work. Let's say it that way. So yeah, I would say HCPC was a thing which took the most amount of time. I had to wait for 6 months. One of my colleagues here, in my first job, he had to wait for like 9 months or so. So it can take time. And I have many people who have now been in contact with me, and they have applied it from India. You can apply it from India as well. One of the things, I had applied it from India before I traveled, but I had to wait for like 6 months for the HCPC to come through. So this happened. And please be aware, if you have applied or if you're planning to apply, it may take time. So the only thing is, which is a bit torturous, but just be patient. It's actually, you can't do anything about it. Nowadays it's online. When I had done it during the COVID times, I had to send a post to to London, basically, which is the main office. So I had to send the post, but now it is all online. So all you need to do is kind of upload all those documents which they require, which they ask for, and it's a bit easier now, is what I would say. It's a bit hassle free. The only hassle now is waiting, which you can't really do anything about it. So this is something I had to rather struggle with, which was my patience. So I was wondering, because you don't get any updates of how what's the progress with your application or anything like that. There's just one day all you get is a mail saying that you are now registered, and you can go to the HCPC website. It's a very good website. They have cleared every single thing in it. So anyone who's planning to do anything, my first advice always, because I keep getting so many questions on Instagram, my only advice, or rather my first answer always, is to request people to go through the HCPC website, read everything carefully. They have mentioned every single thing. And if you follow all that, it should be a hassle-free process. So yeah, this is something which is very important. And if you want to work as a qualified therapist, you need HCPC. So yeah, I waited for that for about 6 months, and then I got my first job in a private hospital as a clinical lead physiotherapist. So I was basically the team lead, and I I was handling both inpatient and outpatient department. I had admin work, marketing work, and all those things. So it was a bit of a challenging job. You had a lot of responsibility, considering, I had to handle the marketing side of it. There was a marketing team as well, so I was basically liaising with them, liaising with all the admin stuff, HR stuff, everything, which is basically what the job role demanded from me. Um, Apart from that, once I was when I was doing this job, I realized that I need to understand the laws here in more depth. So although I had done few courses here and all those things, like there are some mandatory trainings and all those things which I had done, but while working, I realized if I want to kind of progress, or just understand the work, or the work life here, the legal things here, it would be better for me to go in depth into these rules and all those things. So I did that, and what I did some research about it, and I thought that the best place to work would be NHS, which is the government body here. So I thought it would be better to work in NHS, so that I understand the rules here, how the working pattern is and everything. So I interviewed for it, and currently I am working as a senior physiotherapist in trauma and orthopedic department in the NHS. And every day has been a learning experience for me right from the start date. So it is a bit difficult, considering, I would say a bit challenging. Difficult would be too high term. Uh, it is a bit challenging, considering, there are so many new things in terms of legality issues, and what you're supposed to say, what you're not supposed to do, how things work, what's your domain, because it is a bit different from India, definitely. So learning that, or understanding that, was a bit of a challenge, and I'm still learning, is what I would say. So my work experience till now is like 1 year and 4 months now, but I have been here, living here for now 2 years. So it's been a nice experience, and I'm enjoying every bit of it, is what I can say. um, this is something I wanted to talk about, because whenever anyone talks to me, or has queries and come to me, they always are very hung up, I would say, regarding the work life, and how do you go through it, and what do they ask, how's the um, I would say skill mix and all this. So it's all work related is whenever I get those questions. But what I would like to highlight here, which kind of um, they which kind of affects our work life as well, is the social and cultural experience here. So my first is advice to everyone who's trying to, or thinking about coming here, is you need to be flexible in all ways of your life. Life is a bit difficult here in terms of, say, patient expectation, social and cultural norms, and also there's an amalgamation of various ethnicities. So it's not just the British ethnicity. We have got all other different ethnicities apart from, Indians. So each patient has a bit of a different expectation. It would be helpful while you work here is to understand how the lifestyle of the British, or in general your patients, is. The what I have seen is, here the lifestyle is quite active, and honestly I've seen a lot many what we call geriatric here. Mind you, geriatric is not supposed to be termed here now, but in India, what we call the geriatric population is quite, the majority is what I would say, is quite fit, healthy, engaging in leisure activities. And it's when I say leisure activities, not just limited to walking, it's quite high-end activities here, which they enjoy and they want to get back to as early as possible. So, understanding the kind of lifestyle people are having here also helps you to make a very tailor-made approach for them. So that is one thing which you actually need to, understand and make an effort to kind of research and make get that thing into your um, what I would say, in your treatment techniques or treatment expectations and all those things. When I say social and cultural norms, the way the culture here is, what are the expectations of family with the patient, or the expectation of patients with the family, what can they manage to have carers. It's very different from India is what I would say. So having that Indian approach won't work here. So again, you need a bit of some kind of hard work from your side to make an effort to understand how people live their life here basically. And as I mentioned, there are various ethnicities. So I do get many Indian patients as well, or rather say Asian patients as well. So even in Asian patients there are differences. For example, someone from, say, an Indian or Pakistani background would be very similar, but it would be a little bit different if someone is from, say, maybe Japan or things like that. So yeah, basically you have to understand their culture, their social expectations, their work expectations, their out of work expectations, like the leisure activities. What do they expect out of their life? How's the mental status, mental health kind of thing as well. So yeah, this is some research and hard work which would be needed from our side, or whoever wants to kind of work here. And adaptability, there are a lot of things which you need to adapt to, but I would say the most important would be weather because it's actually unpredictable here. And we do laugh about it. And British weather is a, dinner time talk and all those things. But on a serious note, it is important to understand what kind of a weather here is. And many people are actually not able to adapt here. So it would be a good idea to just, have a thought about it, considering we do have harsh winters here. And being an Indian, we are not used to this kind of, you know, this kind of weather, or rather this kind of constant change in weather. Of course, especially if you are somewhere in the central India part. So it is a bit difficult. You can adapt to it, but it is a good thought to, it would be a good thing to have a thought about. So yeah, this was thing. The other thing, which is very important, this side I would say is an extremely important slide. Now, the first thing I would like to clear here is I have not included this slide just because I am coming here as a Sancheti alumni. I genuinely want to tell you about how being a Sancheti alumni has helped me here. As I had mentioned, I had already done my master's in Sancheti. So I was a qualified person, like a master's qualified person. So I didn't do any courses here or anything. I straight away started looking for a job. Now, being a Sancheti alumni, I had whatever experience I had as an MPT while working in Sancheti hospital. It was amazing. And let me tell you, the kind of knowledge which Sancheti provides you is at par with what an international physiotherapist would have. So I am really grateful, and I would suggest, or rather, inform all the juniors and all the MPTs and even the BPTs who are currently a student in Sancheti, basically. Um, please use all the experience you are getting, because please try to learn everything what you are getting over there, because it's at par with what the kind of culture, the kind of work practice people have internationally, at least especially in UK. So basically, I just wanted to give an example. There was a thing called morning MDT rounds with the surgeons in each department. So in Sancheti, so basically like knee department, for TNO department and all that. So we used to kind of accompany the senior therapists, like the people who were working in Sancheti, the senior therapists. We used to accompany them as masters, and you know. There, at that time, honestly, we used to think, we didn't take it very seriously, I would say, because we didn't understand the true meaning of it, how important it is. But now, being a senior physiotherapist myself and attending the morning MDT, I do understand how important it is. And then you realize how important it is to work as a multidisciplinary team, what important role you play in a multidisciplinary team. And that is kind of ingrained, being a Sancheti alumni, in you. So please take that seriously, because that is the part of the day where you can actually discuss things with the consultant, with other members of the MDT. You can raise your concerns, they can raise their concerns, you can discuss, or rather, maybe for some complex patients, you can come to a s- what I would say, at a center path where everyone agrees to a certain point. And yeah, this is the best time where there are conversations happening as a MDT, and each person, you do realize each person plays a very important role in a team. So that happens. And I have realized that how important it is. And you already are getting all that in Sancheti. And this is just one small example. There's so many things. The other thing is research oriented perspective. So here as well, they give a lot of importance to research. And as you all might know, and I'm sure the master students might know, that how we are pushed, if I may say so, to do really well in research. And this was the only reason I could publish my paper. And thanks to Nilima ma'am, I would say, if she wasn't there, my paper would not have got published. So yeah, the kind of push we get, the kind of things, or the knowledge which is ingrained in us, the kind of thought process which is ingrained in us, is very important. And as a Sancheti student, and now as an alumni, I realized that it was so important for me, and it kind of shaped me up, and it kind of prepped me up to have that confidence, and stand in front of everyone, and have that thing that I have done that, I know about it. So if you are a Sancheti alumni, please, or rather a Sancheti student, I would say, or someone who's studying at Sancheti at whatever level, be it PPT or masters, I would say please use all of your experience, take in as much as possible, because you are in one of the best institutes, and I'm not kidding, honestly. This is Sancheti has shaped me up, and excuse me, that is the reason I was able to kind of go through everything. I did not actually need to, prep myself with a course or anything, or an extra anything, to be able to work or all those things. So yeah, Sancheti is one of the best institutes, and if it is not necessary, because I get this question so many times, that is it necessary to do a course and all those things. If you're using your knowledge very well, and if you're reading properly, thoroughly, you are well updated with all the new techniques and all the research and what's going on in our work field. Mind you, this is a very important thing in all the interviews. So here's the big announcement here, big breakthrough for whoever is trying to kind of go through, clear the NHS interviews. You need to be well updated with all the current things which are going on in our work field. So books just won't help you. You really need to be very updated with what's going on. So yeah, and that is kind of ingrained while you are doing your MPT. So please take all that seriously, and yeah, that will help you a lot. You don't actually need to do a course, but if you want, you can, but that's not a necessity. So yeah, that was my experience till now. So thank you so much for this talk. I hope it was of some information or some guidance for you all, and you can always approach me for any questions. If need be, we can maybe, I don't know, I'll have to ask maybe Sona ma'am or Physio TV, or we can do a specific more, how to kind of come to UK, and how to do all those stepwise process. If you want anything like that, we can always do that kind of a talk as well, or maybe a course or whatever. We can see what we can do about it. So thank you so much for that.
On behalf of Physio TV, I would like to take this opportunity to thank you, ma'am. It was indeed an enlightening talk. I am sure this will encourage a lot of budding physiotherapists to look forward for working in UK and building their career. We're surely looking forward to collaborating with you again. I would like to extend my gratitude to the chairman of Sancheti Group, Dr. Parag Sancheti sir, our chairperson, Mrs. Manisha Shangvi ma'am, our principal, Dr. Apurva Shinti sir, our technical team, and all the viewers of Physio TV. Thank you all and have a great day.